10 early warning signs of parasites that require immediate action. There is probably no darker chapter in human medicine that produces the most misdiagnoses or leads to undiagnosed conditions. It's about parasites. Whether on a hike in the mountains, harvesting fresh vegetables from your garden, or simply drinking water abroad, you can catch parasites almost anywhere, even at the playground. The possibilities for infection are truly, truly diverse. If you have a dog or a cat, then you know this. The first or last action at the vet is deworming. I myself now have 15 years of experience in parasite diagnostics and also in parasite therapy. And in this video, we will simply look at what early warning signs, what symptoms parasites can primarily cause. We will focus mainly on intestinal parasites because they are the most common in our regions, and I can promise you, you will be amazed at the health problems that can be caused by parasites. Additionally, we'll address the biggest mistakes in diagnosing and treating parasites. So buckle up, here we go. And one thing I can promise you up front, there are no gross images in this video. The fascinating and also alarming thing about parasites is that they can cause extremely wild symptoms. You'll see this throughout the video. There's probably no more intriguing topic in medicine than parasites. And look here, parasites as a cause of urticaria. Urticaria is hives. When the face swells up, when you have a strong histamine reaction similar to an allergy, this can be caused by parasites. And name me the doctor who immediately thinks of parasites with such symptoms. When you go to the practice and say, my face is swollen, what will happen? You will get a histamine blocker. And there are really, really interesting parasites like this little worm here that I can reproduce visibly under the skin. Or here the pork tapeworm, which can eat our brain and make actual holes. Don't worry, that's it for the pictures now. And let's do a little classification at the beginning. Really not much theory, just very, very briefly. There are the single-celled ones, you all know them, like malaria, so really single-celled parasites. The amoebas, they cause amoebic dysentery. The trichomonads, a sexually transmitted disease. It's estimated that 150 million people are currently affected worldwide. Or Giardia intestinalis, causing severe digestive issues. These are the capabilities of single-celled organisms, often requiring potent medications for treatment. Moving on, we encounter ectoparasites such as fleas, lice, leeches, ticks. Lastly, we delve into helminths, which encompass flatworms known for their flat appearance. We have tapeworms, which are as long as a ribbon. Then we have roundworms, which look like a thread. Roundworms are more round. And then we have leeches, the sucking worms, which latch on tightly. The big problem with parasites is that they infect stealthily and cause slow developing symptoms, especially here in our regions. It's often the intestines that are affected. As digestive issues begin to surface, the often neglected problem becomes evident. My cousin, who is a veterinarian, emphasizes that every pet is plagued by parasites. Through my use of parasitic or anti-parasitic medication, I strive to alleviate this burden. Nevertheless, he highlights the difficulty of maintaining a pet free from parasites, especially if they ingest feces or prey such as mice. These actions serve as major avenues for parasite transmission, making it nearly unfeasible to entirely prevent infestations. Yes, and this is how these worms can look. There are long worms, thin worms, flat worms. Nature has really produced a great variety here. And here we can see how an infection cycle can occur. In this case, for the pork tapeworm, you eat infected meat. You ingest this meat. From these larvae, larger creatures develop, which then lay eggs again. The pets get infected once again, perpetuating this closed cycle with parasites. It's our responsibility as doctors to recognize and put a stop to this cycle. The major issue is that this method doesn't work effectively in our regions. Why does it fail? We often associate parasites with third world countries, imagining worms and flukes thriving in water bodies. And that's our perception of a parasite. But in countries like the USA, Canada, or even in Europe, Spain, Portugal, and so on, it's just not on the radar. In other words, we have an extremely high number of unreported cases, and doctors don't immediately think of parasites. What makes it even harder, and this is the first major mistake in diagnostics, is that you need to send in a relatively fresh stool sample if you want to detect eggs or larvae. This is just our standard diagnostic procedure. That's how we are taught. And I've copied an instruction from the lab at the University Clinic Freiburg, which is available online. It states that to rule out intestinal pathogens, protozoa and worm eggs, 3 stool samples taken on 3 consecutive days are initially required. Furthermore, they write that these stool samples, when considering single-celled organisms, must be in the lab for examination within an hour. And that's the big problem. When we do a stool test in practice and then send it off, it comes into contact with heat, and there are simply no eggs left in it. Firstly, it's crucial to note that everything is deceased, and secondly, these parasites may not consistently deposit eggs. This indicates that the laboratory is following correct procedures by demanding numerous samples and swift transportation to the facility. However, our local infrastructure falters here, particularly in rural regions, due to our inability to handle it. I am lucky to have a medical laboratory in my local area where I can advise my patients to promptly submit their samples for analysis. Next, let's proceed to the initial red flag, which is sudden and unexplained weight reduction. Once there was a patient under my care who was overweight and started losing weight rapidly, shedding 20-30 kilos. When I questioned her about this sudden change, she seemed uncertain and untroubled. As a doctor, my first thought veered towards cancer, leading to a comprehensive check for any signs. With none found, my next suspicion was a potential parasite. I prescribed parasite medication, and to my amazement, what she expelled turned out to be a tapeworm that is at least 40 centimeters long, managed to stop the weight loss immediately. However, many individuals face weight loss issues or find it hard to gain weight. Even in our regions, a gut parasite could be the root cause. Why is this the case? The parasite deprives us of vital nutrients, disrupts proper absorption, and has an extremely high metabolic demand. In essence, it consumes our food, leading to these challenges. And it causes us a chronic inflammation, which can lead to such an unexplained weight loss. And the question is, why are there such severe symptoms with parasitic infections? Because this parasite simply goes into direct conflict with us humans. It wants to live on or in us and doesn't hesitate to use our resources. And as mentioned, it drains us of nutrients, but it can also cause tissue damage, which we will see later in the video. It can cause organ damage, and of course there can be some kind of immune reaction from the body to this parasite. This can then cause a major inflammation. And what can also happen if you're heavily infested is a mechanical blockage in the intestines. That means the stool doesn't move and the digestive system comes to a halt. And what's really extreme is that the parasites can release severe metabolic toxins, as we'll see later in the video. And also a very subtle early warning sign to watch for is anal itching. Small children often report this when they get infected with pinworms, which are completely harmless. The egg laying around the anus, that's the problem. The movement of the worms, especially at night, can cause allergic reactions around the anus and skin damage, leading to an itchy bottom. So if you have small children, if you're grandparents, if you're parents and your child says, "Mom, my bottom itches," it's 95% likely to be worms, pinworms. The infection rate is relatively high, affecting 1 billion people, with an estimated 20% of children in our regions and 50% of children in developing countries affected. And we have a very high treatment success rate, over 90%. You can even get over-the-counter anti-parasitic medications at the pharmacy. Do you know a cough like this? It's a cough that can be caused by parasites and can come out of nowhere. It can get really intense with severe coughing fits. It can be episodic, lasting about 5 to 15 minutes, and then there's a break of 7 to 10 days, and it can have no apparent cause, no cause at all, and it can really go on for months and years. And if you have a cough like this, where it seems to come out of nowhere, where you can't do anything about it, where it sometimes gets so bad that you think you're going to die because you can't breathe, and after a few minutes the attack is over, it just vanishes, you recover and think, well, that was just a one-time thing, but after 7 to 14 days it comes back. A little roommate could be to blame. The so-called roundworm Ascaris lumbricoides is one of the most common worms worldwide. In humans, And it's just a classic intestinal parasite. And the story of this little worm is really wild. I can speak from experience. I had it myself and went through all of this. It's very, very interesting. The larvae live in the soil. You can get infected, for example, if you had a grandfather like mine who just pulled a carrot out of the ground, wiped it off a bit, and then boom, ate it. Snails can, of course, be carriers here, feces and so on. Very small eggs can be laid, and then you just ingest them. You can also get something like this on an alpine hike if you take a quick drink from a stream. Never do that. The water contains feces from animals, cows, and so on. Please never do that without taking some precautions. The problem is we ingest these larvae that live in the soil. They then travel to the intestines, then to the liver, then to the heart, and now it gets gross. They move to the lungs and then leave the lungs. They exit the lungs through the alveoli, crawl up to the larynx in a very microscopic way, and from the larynx they go back down. We essentially swallow them again, and their final destination is the intestines, where they become the so-called large adult worms. And this is typical, that when these nasty parasites go through this cycle, these worms, it can lead to coughing fits. And one of these creatures can lay up to 200,000 eggs. The big problem is that this becomes a never-ending story. In some places, not so much in our regions, but in other countries, you can find hundreds, even several hundred of these creatures in the intestines. In tropical countries, we have over 90% infestation, and the problem is that this Ascaris worm can actually anchor itself in the intestines with its teeth. And this is a huge, huge problem, as we will see during the treatment. And then it's not surprising that parasites that have infested the intestines can cause all sorts of gastrointestinal issues, so diarrhea, constipation, bloating, abdominal cramps, for example. But it goes further, also nausea, and here I really want to make you aware of nausea upon waking up. So if you feel nauseous right after getting up without having eaten anything, brushed your teeth, or anything else. This is also a very, very sensitive warning sign, an early warning sign of a parasitic infection. And it can then progress to loss of appetite, vomiting, and so on. Here, inflammation is seen as the cause, affecting the stomach lining, which then also develops an inflammation problem. And what also happens very, very dramatically is that people suddenly feel incredibly exhausted. They then receive psychological diagnoses such as a psychovegetative exhaustion syndrome, mild depression, or things like burnout, for example. They feel poisoned, so exhausted that they can't even lift a finger, completely powerless. And the cause here is toxins. And there is a very, very interesting analysis already from 1912 examined by a toxicologist, Dr. Fleury, his roundworm analysis. So he basically mixed many, many kilos of roundworms and examined what toxins they could produce, what toxins were in them, and he found chlorine and phosphoric acid. Just imagine that, chlorine and phosphoric acid. He found toxic alcohols, fats, and fatty acids, and he also found conine, another potent toxin. The problem is that these toxins, as he further investigated, can cause coagulation disorders and immune problems in animal experiments. And now it gets really psychiatric. They can cause hallucinations, hysteria, epilepsy, delirium, convulsions, all these severe symptoms. And I really want to go to a psychiatric hospital and distribute anti-parasitic medications. I would really like to conduct this study and see how many people improve immediately within a few days with their psychiatric diagnosis. The problem is these toxins are very, very severe capillary poisons, very, very severe vascular poisons, and they simply attack our body and the sensitive organs just shut down. And let's think one step further, phosphoric acid, the phosphate, can cause severe restlessness in children. ADHD, these hyperactive kids, it could simply be due to intestinal parasites or unclear allergies because of these toxins. And we are really talking about Ascaris, the very, very common worms in humans worldwide. And at the beginning, I had already shown you this study with urticaria. This implies that these parasites have the potential to induce allergies, result in skin irritations, or even contribute to food allergies and intolerances. They may also be responsible for leaky gut syndrome, histamine intolerance, or histaminergic symptoms. Moreover, there is a possibility of mistaking them for SIBO, where harmful bacteria migrate from the colon to the small intestine and generate gases, leading to comparable symptoms. Therefore, it is crucial to keep intestinal parasites in mind when encountering such problems. As previously mentioned, a parasite could be a factor in being underweight. Additionally, experiencing cravings can serve as an early indication of a parasite presence. Due to the high metabolism of these parasites, there are simply people who can eat without gaining weight. Maybe you know someone like that. Of course, it could also be due to the thyroid hormones or other causes. But parasites can also cause us to consume large amounts without gaining weight. And often, a constant craving for sweets is a signal that parasites might be involved. And because of all the toxins, inflammation and immune processes, the intestinal lining may not function properly, leading to poor nutrient absorption, nutrient deficiencies, and especially protein deficiency. This is often seen in individuals affected by parasites. Another signal is iron deficiency. So, children with loss of appetite, please always consider iron deficiency in the future. And then think one step further. Why does the child have an iron deficiency? Could a gut parasite be behind it, preventing the child from properly absorbing iron? And above all, you should be vigilant if you return from vacation and suddenly develop headaches. 14% of people in our region suffer from migraines. The number of headache patients is even higher, and especially be cautious if you come back from vacation. Whether it's Spain, Portugal, hiking in the Alps, in Austria or Switzerland, or a stay in Mexico. So if headaches occur after traveling abroad, always get it checked out. Those little cohabitants can trigger it through their immune reactions. For example, the pork tapeworm or toxoplasmosis. Malaria, of course, would be pretty severe. I even had a malaria case in my practice once, which I immediately referred to the hospital and straight to the intensive care unit. He survived. And babesia can also be a cause, which is more common. But just remember, after traveling, if you have headaches for weeks, get it checked out. So now the big question is, what can we do in therapy? And I know the internet is full of alternative suggestions against parasites. But please keep one thing in mind. I've been in this business for over 15 years and have treated hundreds of patients. We're dealing with extremely aggressive cohabitants here, and the parasite has only one goal. It wants to stay in your body. And intestinal parasites in particular can be really, really hard to treat. They have biting tools, and if you look at them under a microscope, they anchor themselves firmly into the intestinal wall. They have proteolytic enzymes that essentially dissolve the intestinal tissue to anchor themselves even better. And I can only warn you and share my experience. What you do is ultimately your health decision. But as a professional, I can tell you that most of these so-called remedies out there usually have zero effect. So what do we need? We need a conventional medical antiparasitic that most people are incredibly afraid of. I'll be able to dispel that fear shortly. The problem is that with these alternative medicine approaches, we just can't affect the metabolism of the parasites enough to make them release their grip and leave the body. So don't waste your time. Completely unsuitable zapper. Also completely unsuitable. Any herbs, garlic, seeds, whatever else is out there. And please don't be misled by alternative medicine studies. I'm not ruling out that indigenous tribes might have plants that work really well, but in our regions we simply have good remedies, and the problem is that people are just scared of these anti-parasitic drugs, and there's really no need for that. Why? Parasite medications are designed to stay in the intestines. They are not meant to leave the intestinal wall. This means you can't compare a parasite medication to aspirin, a beta blocker, a kidney medication, or a painkiller. These medications are designed to kill the parasites, and they generally work very, very well with few complications and side effects. That means the parasites are laughing at your feeble efforts. The only thing that happens is that they keep these residents even longer. And as I mentioned, these treatments are really very, very well tolerated. They hardly get absorbed into the blood. There's a lot of experience with them. There are other countries, not just our small Europe, but globally in the third world, antiparasitic drugs are prescribed incredibly often. So, the experience in this regard is very, very extensive. In Germany, they are very, very expensive. But globally, they are very, very cheap. They are becoming increasingly unavailable in our country, which doesn't make the work of therapists any easier. I don't want to speculate on the reasons, but the only problem here is simply that we should keep this in mind. And you can go ahead and take a shot in the dark here. And I also want to urge my colleagues, if they have the slightest suspicion, if a child comes in with clear symptoms pointing to parasites, just prescribe a mild broad-spectrum dewormer. There's really no big problem with it because the medications are just so well tolerated. So just go ahead and shoot from the hip and kill the parasites. What's the big deal? Often you just need to treat a few more times because you can only kill young or older parasites, but if they've laid eggs, new ones will hatch. You have to be meticulous about hygiene, meaning wash everything, especially if it's about pinworms or something similar. These are precautionary measures, and you should really wash garden vegetables thoroughly and not just consume them as they are. If you have a trail camera, you can have some fun by setting it up in your garden to see what kind of animals crawl around at night. Now imagine that's a playground, and then the kids touch everything and put their hands in their mouths and so on. So a parasitic infection is not something to be afraid of. We just need to re-establish parasitic infection as a diagnostic possibility in our minds as therapists. And I think we can really handle this problem well and identify many more patients who actually have nothing more than a parasitic disease. I look forward to you tuning in again. Thanks to my channel members who support me so well here on this channel. And if you want to know more about parasites, just leave a comment and I'll make more videos on the topic. Thanks for watching. See you in the next video. See you soon.